All right, let's get started. I want to officially welcome everyone to today's webinar on OpenNotes in the safety net, where you're going to hear a lot of real world experiences of sharing progress notes in the safety net. My name is Liz Salmi. I'm the Senior Strategist of Dissemination for OpenNotes, and I'll be introducing you to our lovely guests today. For everyone who just joined us, welcome again to today's webinar, OpenNotes in the safety net. We're excited for this session and glad that you're with us. We're presenting in 3 segments. First, Dr. Cait DesRoches, the director of OpenNotes, will talk a little bit about OpenNotes, and then you'll hear from our special guest presenters, Dr. Ruth Lesnewski and Nandini Schroff. Finally, we'll then transition to an open Q&A and dig into the questions box. So first presentation, I want to introduce you to Dr. Cait DesRoches. Dr. DesRoches is the executive director of OpenNotes and an associate professor of medicine at Harvard Medical School. She's a distinguished health researcher and an expertise in emerging trends in healthcare and delivery, and I'm going to hand it over to Cait.
Thanks, Liz, and I'll just start by saying thanks to everyone for being with us today, our presenters. We're very excited to hear about what you're doing in your organizations, and thanks to everyone who signed up to come along with us this afternoon. So I'm going to talk very briefly just to make sure everyone's on the same page about what OpenNotes is, and then we'll get right to the main event. So I'll start off with who is OpenNotes. And the first thing I'll talk about is what we are not. So we are not a software company. We do not have an app. We don't code things, we don't have programmers, we don't have a server full of notes somewhere. We are a collection of people at the Beth Israel Deaconess Medical Center and Harvard Medical School who are focused on the idea of transparency and how to use transparency to improve care and patient experience. And we are funded almost entirely through philanthropic, through foundations, and then some private philanthropy. We do have a couple of federal grants, but we're all, we receive no industry funding, and we have no financial relationships with the tech sector. Next slide. So what is OpenNotes? It's a very simple idea. It's an organization is doing OpenNotes when patients can easily read their visit notes, either mostly through patient portals. We have had a few places over the years who have done this on paper, but it's primarily a portal-based intervention. So this slide represents the status of where the country was prior to April 5th. So prior to April 5th, we knew of about 260 organizations that were sharing notes with patients and through their portals. And by our best estimate, that was about 54 million people in the United States who had access to their clinical notes through a patient portal. Life has changed since that slide was made. On April 5th, 2021, the Cures Act information blocking rule went into effect. So this rule is part of the 21st Century Cures Act, which was passed under the Obama administration. And in that act, there was a section that directed the Department of Health and Human Services to improve interoperability. And there was a sentence in there, in that section, that said, and patients must have access without charge or delay to all of the information in their electronic health records. Fast forward 4 years later, 5 years later, and a lot of conversations about what the word all means. And we came to the information blocking rule, which specifies in the US core data for interoperability. So that's the acronym you see on the right-hand side of the screen, the USCDI. All of the information that has to be made available to patients through the portal. And that information includes 8 kinds of notes, including progress notes, procedures, pathology reports, lab reports, imaging, discharge summaries. So a lot of information that was not previously available to patients now has to be made available either through the portal or another electronic means. There are some exceptions, and I'll just note them, and then I'm going to turn the mic back over to Liz. Because there is a lot of provider concern, I just want to highlight there are a couple of exceptions. So providers can choose to block a note if they feel that releasing the note will cause physical harm to a patient or someone else. So that someone else could include the clinician, where they have a real justified fear that this is going to cause physical harm. So that's one scenario in which a note can be blocked from the portal. Another is if it will violate a patient's privacy. So if a patient says, please don't send that to the portal because I don't want a family member to see it, that note can be held back. But to understand that this cannot be a blanket, this is not a blanket exemption, it's applied on a note by note basis, and there has to be a good justifiable reason for why you're doing it. So with that, and I'm happy to take any questions when we get to the Q&A. If people want to know more about the rule or have questions, I'm happy to take them, but I want to make sure we have plenty of time for our main event. So I'm going to turn it back over to Liz.
All right, thanks so much, Dr. DesRoches. Really appreciate that. A lot of people have questions about that, so I'm sure we'll get into that a little bit more. So OpenNotes would like to recognize and thank the New York State Health Foundation for providing grants to a number of health systems in New York State over the past few years that have helped them implement open, transparent visit notes with patients. And the Institute for Family Health is one of these grantees. And so that's the folks we're hearing from today. So Dr. Lesnewski is the clinical director of My Chart, My Health, which is the patient portal for the Institute for Family Health. It's one of the largest community health center networks in New York State, and they're serving over 115,000 patients annually at 32 locations. That's a lot. She is a board certified family physician and works as an attending physician at Beth Israel residency program in urban family practice, and is also an education coordinator of the Reproductive Health Access Project in New York. And then our second presenter, they're presenting together, along with her, is Nandini Schroff. Nandini is the Research Committee Administrator and Grants Manager for the Institute for Family Health, and her public health interests include disparities and women's health, with a particular emphasis on reproductive and sexual health. So welcome to our guests, and we're excited to hear from you.
Thank you so much. Can you guys see the screen? I can't actually tell.
Yes, we can see it. It looks good. We can kind of see your sidebar also. So if that, which is fine, or you can go into presenter view.
Is that better?
Let's see.
Oh, no.
It looks good to me.
Okay.
We should be fine.
Okay, sounds
All
good.
right.
And whoops, okay. I think something's happening, sorry.
That's
I know
okay.
I have two slides. I mean, I have two monitors, so I just need to figure out which one I'm sharing.
That's presenter view, but I think it was okay the way you're doing it before, unless you need to see it this way.
I mean, I don't need to. I just figured you guys could.
There we go. This is good.
Okay. All right, sounds good. All right. Hi, everyone. Thank you for the great presentation, Liz. As you mentioned, my name is Nandini Schroff, and officially my title is a Research and Grants Manager, but I am helping oversee our OpenNotes implementation at the Institute for Family Health. And as Liz mentioned, I'll be co-presenting with Dr. Lesnewski on this initiative, who is our clinical champion. And sorry, I know some of you guys probably got excited that we didn't have any slides, but unfortunately we did have slides, so I hope we're not contributing too much to the PowerPoint fatigue that's going around. So before I dive into like our OpenNotes implementation itself, I'll sort of give you an overview of who the Institute is and the patients we serve. So again, I know this was in our intro, but the Institute does have 32 sites across New York City and the Mid-Hudson regions. We currently we provide primary care, mental health, and dental care to over 115,000 patients annually. We use Epic, and we've been on Epic since 2003, so we have a long history with this particular EHR system. We've actually, when we initially got the grant through the New York State Health Foundation, we were pretty excited about implementing OpenNotes. One, because we really do believe that this will increase engagement of our patients in their care and ultimately help improve health outcomes. And then in terms of our patient profile, we primarily serve the medically underserved population. 29% of our patients identify as Black African American. 38% identify themselves as Hispanic, Latino. 12% of our patient population is 65 and older. 13% speak a language other than English. And we looked into some data and we found that 7% of our active MyChart users, which is our patient portal, users actually indicate Spanish as their primary language. And we do offer our patient portal in both English and Spanish. And in terms of like insurance, 48% of our patients that we serve have Medicaid and 13% are uninsured. And so for our OpenNotes implementation, the Institute actually decided that we would share all of our notes across all of our sites, departments, and populations. So like basically all of our patients who access primary care, behavioral health, dental care, nurse who only have like nursing only visits or social support services are all able to access their visit notes. We also share our notes for like adolescent population. So we basically haven't restricted access to visit notes. The first year of our the grant that we got through the New York State Health Foundation was primarily like a planning year for us, where we did a lot of focus groups with patients, did staff trainings, completed technical build, and the second year was really when we went live and are trying to conduct some post implementation activities, including evaluation and other things that we couldn't, that were sort of delayed. And I'll talk a little bit more about that. So just going a little bit more into depth about our pre-implementation activities, the first year of our grant, we did conduct 3 patient focus groups to assess patients' knowledge, attitudes, and expectations around OpenNotes in December 2019. And the findings from these focus groups were really used to inform our staff trainings and promotional efforts thereafter. So we found through these focus groups that none of the patients really knew about OpenNotes, but after learning about the rollout of this initiative, participants really just had a primarily positive response. There were various aspects of OpenNotes that they were excited about. They spoke about increased transparency between them and the providers, and ensuring that the concerns discussed during the visits were accurately understood. Moreover, OpenNotes would also allow patients to reference what was discussed during the visits, like, prescription instructions, methods of coping, diets, or other recommendations that they were given, so that they did not really have to rely just on memory about like, oh, what happened during the visit. With access to their visit notes, patients also felt like they would be more informed about their own health, since they could review the treatment plan in more detail and better understand why it might have been suggested by their provider, just researching about their diagnosis on their own. They also felt like it would actually lead to improved communication between patients and providers. And in general, participants actually were not super concerned about seeing notes that they did not like or disagreed with. They felt comfortable enough having a discussion with their providers to figure out why something was written or clarifying something that they might not understand in their notes. A few concerns did come up for participants around OpenNotes. One of the concerns that was raised was just around provider documentation. They were concerned that providers might use medical jargon that would be hard to understand, or that they might be more cautious about what they write, because now that they know the patients are viewing their notes, so that they might make the notes briefer. The other big concern that really came out was just around security of their health information in MyChart, and using OpenNotes, like for example, like hacking and all of that. So I think they were just in general concerned about data security. And then in terms of trainings, we did use a lot of the materials that are available on the OpenNotes website. I know Liz made a plug earlier, and we do highly recommend it. I mean, we used a lot of the materials that are available on the website. We used those as templates, and then we adapted and developed presentation materials for staff, including PowerPoint presentations, a one-pager that's offered on the website called OpenNotes by Numbers, a brief info sheet for reference for our staff and patients in case there were questions that came up that staff knew how to answer. And then some of the department leaders that we had tapped into, like they further adapted some of these materials for their own staff. So for example, our nursing department created like OpenNotes for nursing, very specific to sort of their staff. And so far we have presented OpenNotes at 17 different meetings with a total of about 170 participants. And then Dr. Lesnewski actually presented to at a lot of the provider meetings. And when she was presenting, there were some concerns around just increased workload, specifically having more messages or questions from patients regarding verbiage and progress notes. And this is sort of like similar to what we had read in the literature about the initial concerns that a lot of providers have before going live. So we were not super surprised by that. So the actual implementation, we went live on September 12th of 2020, and we employed an opt-out model so that by default, notes were actually shared to all patients unless the provider consciously made a decision to uncheck the share notes field. So over here, it's basically a default is share with patient, and unless they uncheck that box, the note would be shared with patients. And then these are the screenshots here where what the patients actually see on their end in the patient portal when they're trying to access their visit notes. So you'll see, view notes, and then once they go into that page, they'll see the after visit summary, and the notes is a separate tab. And I also did want to mention that starting this month, actually in April, there is now a hard stop for clinicians who uncheck the share with patient box that requires them to provide a reason for not sharing the note. So even, like regardless of whether or not you want to share a note, they must provide a reason. And I think part of it is because of the regulations Cait had mentioned earlier. And then some of the other implementation activities that we did, like just prior to going live, we worked with our in-house communications team to adapt and create some patient promotional materials in order to raise awareness of OpenNotes and its availability through our patient portal. We created a digital slide to display in the waiting room, and that's the screenshot you see over here, and an FAQ for patients. We also included a message about OpenNotes and a link to the website in all of our after visit summaries and on our website as well. So the next few slides are actually just a lot of our data slides. Sorry, excuse me. And so this first graph really shows the data organization-wide by month since it went live in September. And as you will note, after September, the percent of notes shared with patients is about 80%. And it's holding relatively steady at that point, although we do see a significant uptick in March. So I wonder what's happening there. And we were actually pretty surprised to see that only about 7 to 10% of the patients actually view their notes. So we are not sure if the patients don't realize that they're now available, in which case we do need to improve our awareness activities, or if the patients know it's there, but they're like, it's there and it's fine. So this graph is similar data, but it provides it by department. As I mentioned, that we actually share this across all of our departments. And so it shows primary care, behavioral health, dental, and case management. And of course, by far, primary care notes are, although they have the lowest number of shared notes, with dental being the highest, it's still like a significant, in terms of number of shared numbers, primary care is the most shared. But it's also interesting to note that more primary care patients have actually viewed their notes compared to the other departments, and that percent of viewed notes is actually higher than the organization as a whole. And some of this is not surprising, since of course, like, our main services are primary care, so it seems to make sense. And then this is just some additional data where we're trying to see some trends by health centers and see if there's a difference in, the number and the percentage of shared or viewed notes across the different sites that we have. And this one, this graph is focused on our health centers in Manhattan and Brooklyn. And we already sort of, start to notice a variance in the number of shared notes and viewed notes. So for example, you'll see at Cadman, like, nearly 18% of patients who visit our Cadman Health Center have viewed their notes. And we do think some of this has to do with the variation in our patient population and the health center staff. For example, there are like, we recognize that there are socioeconomic differences, among our patients, depending on the health center that they tend to go to. And then at some of our sites, some providers are just big proponents of MyChart in general, and I wouldn't be surprised if they're really encouraging patients to go online and view their notes. So we might see discrepancies over here for sure. And we're hoping that we'll find out a little bit more when we do some of our post-evaluation survey work. And again, this is just similar graphs, but these are health centers located in the Bronx for us, and this is these are our health centers in the Mid-Hudson region. And again, like, we do see a really big variance in the number of shared and viewed notes. So we do still need to do our formal evaluation, but so far, just based on some anecdotal feedback, we haven't had any major concerns from either staff or patients. We've heard from providers that they were actually surprised that they've had less feedback from patients than they had initially anticipated. That was one of their biggest concerns when we were doing some of the trainings. And really the transition to not sharing notes versus sharing notes was pretty seamless. Like, it didn't feel like there was any difference in their workload. People heard from patients that they actually feel good about having access to certain parts of their notes. They've also raised things they see in the notes during their visits with the provider, but in a good, meaningful way that really fosters a discussion between the patient and the provider. And then one of the things we're currently working on is providing OpenNotes for non-English speaking populations. So currently OpenNotes is only available in English. And so we are trying to finalize, and we're almost there actually in our workflow for providing OpenNotes for non-English speaking population. And so I've basically outlined a brief overview of what our workflow is going to look like, where patients can request their notes, which are currently in English, to be translated into a language of their preference. So when a patient views their notes in the patient portal, we've embedded a message asking them to submit a support ticket for a notes translation. And so on the back end, the message is actually routed to our case management pool, who then picks up the message and gets the notes translated from our translation vendor. We have a more detailed workflow specific to what the case management team does from that point on, which is right over here in blue. So the case manager will basically find out which of their notes needs to be translated. They'll convert the note from a PDF to a Word document, upload it to the Lender portal, and once the note is translated, send it via the MyChart portal to the patient and upload the note to the patient's chart in Epic as well. And like I said, we're almost there in terms of finalizing this workflow. Everything is in place. It's actually, and I'll mention this later as well, it's actually going to go live in June. So we're pretty excited about this. And we'll see what the, sort of what the need is like, or the demand is for this kind of service, especially because we do have a relatively high non-English speaking population. Just in terms of some of the challenges, again, last year, I think we all know, has been kind of crazy. And so even our implementation of OpenNotes has not been without its challenges and delays. The COVID-19 did change some of our implementation activities. We did have to suspend our staff presentations over a period of time. We couldn't get representation from our Mid-Hudson regions for our patient focus groups. Before the pandemic started, we did delay our OpenNotes implementation based on feedback from clinical leadership. So these are just some of the few challenges that we've encountered. And the other thing I haven't mentioned here is we were hoping to have our translation workflow in place for a while now, and there have been some delays in that as well. So I definitely have encountered some of those. But despite some of these challenges, I think we were also able to leverage the implementation of OpenNotes to really just thoroughly review our note writing templates and some of our other EHR features to ensure that they are patient friendly. We also use some of this, we're also using this opportunity to boost our patient portal enrollment so that more patients can access their notes online. I mean, the one, I guess, looking at the silver lining, I think one of the things the pandemic has done is because of all of the telehealth visits and all of that, like, we've really encouraged our patients to also sign up for MyChart. So in addition to like sort of promoting OpenNotes, I think that has also helped us make sure patients are getting access online. In terms of next steps, we do want to conduct a formal evaluation, which includes feedback surveys from our support staff, providers, and patients. We've already started this process. We have our surveys completed, and we are hoping to start distributing these surveys in May of 2021. So we're really curious to know what the feedback is going to look like. We are planning to survey about 2,000 patients. Right now, 1,000 of whom have actually viewed their notes, and 1,000 of them have not viewed the notes, to really determine or identify reasons for why someone is looking at their notes, why they're not looking at their notes, and to see if there's anything we can do on our end to sort of increase that rate. We also want to, as I mentioned, we are also hoping to implement the translation services workflow by June 2021. We also just recently built out all of the data reports that I had shared earlier with you guys. So we do want to analyze this data on a routine basis and sort of share with our leadership just for quality improvement purposes. And as I mentioned, we are also really curious about figuring out what the most common reasons are for providers not sharing a visit note, especially since that hard stop has gone into effect starting this month. And then lastly, we are hoping to develop a white paper or a case study just to talk about our experience with OpenNotes so far. And I think that's the end of our presentation.
Oh, wow, that was awesome. Okay, so everybody's applauding, but you can hear me applauding. I loved the data that you shared, but us OpenNoters, we're kind of bar chart nerds, and are easily excited about charts and graphs and data. I want to remind everybody, you can put your questions in the question box, and moderating that Q&A is Deb Wackenheim, who's the Director of Dissemination for OpenNotes. And while you're inputting your questions, and I'm sure you have tons, I do want to remind you that next Thursday, April 22nd, we're going to have office hours, a full hour with today's presenters, and Dr. Abhat will be there as well, talking about her experience at LA County. And it's just a free-form open Q&A, and we'll put the link to where you can sign up for that in the chat box. So we're all here. Deb, what kind of questions are we seeing?
Okay, I will start from the top. How do you handle release of notes for teens and adolescents?
Great question. So we dealt with this early on in turning on the portal, and what we decided to do is provide full access to children themselves starting at age 10. So kids can get an active portal account starting at age 10, and they can see everything that an adult would see. And then there's the issue of proxy access. So like a parent accessing a child's chart, right? So proxies can see their children's information from age 0 until 10, just as if it were an adult's chart. They can see everything. Between 10 and 18, they can see very limited information in the chart. So, almost everything is blocked. They can schedule appointments and they can send messages, but they can't see the problem list, they can't see notes, they can't see test results. Almost everything in the chart is blocked. So that same model is what we use with OpenNotes. And there is an exception that can be used for parents who have a good reason to need full access to a child's notes. We were thinking maybe for kids who are, have various kinds of special situations. But as far as I know, that special exception kind of access has been used only once in all the years we've had this going. So
that's interesting. Is the 10 to 18 like a state defined age group of when the record should be hidden from parents?
Funny thing is that we went round and round about what the age should be, and came up with 10 as sort of the earliest age that sexual and reproductive and mental health issues might come into play and need to be concealed from a parent or guardian for safety. But then soon after we made that decision, New York State came out with something. I don't remember exactly what it was, but New York State has some official thing now saying 10 is the age.
Oh,
so
okay.
They aligned with us.
You're ahead of them.
No coordination at all, but that's what happened.
That's interesting. All right, what else do we have in the chat box, Deb?
How do you define timely access? Hours, days, weeks?
So I don't know what the people who wrote the legislation meant by that, but what it means in our system is that as soon as the encounter is closed by the clinician, the note is available to the patient.
How do you manage patient concerns for data security?
We have lots of layers of security built into the portal. Honestly, I get more complaints about how annoying all that extra security is than I do concerns about other people hacking in. But there are some patients who are really worried about that and who decide not to activate their portal due to security concerns. So, it's not possible to say the risk is zero, right? I mean, so many things have been hacked into. The risk is greater than zero. So,
Cait and I had a meeting earlier today, and we were talking about one of the first ever OpenNotes studies published 2011, 2012. The there was a question around how concerned are you about your information, health information online. And there are people who said they're concerned, but they still want to read their notes. And then more recent studies, 2017, data from 2017 showed that those kind of big concerns about health data security and being on the patient portals had gone down. So it's almost like as years go by and people are used to engaging with information online, that we're seeing that in our own survey questions kind of go not completely away, but getting less so.
That's interesting.
Yeah.
So there are a few questions. Sorry, you going to say something else?
No, I could ask questions all day. I'll stop. This is everybody else's time. Sorry.
So there are a few questions relating to translation of notes, and I know you haven't actually kicked it off yet, but if you have any sense of how this might go. What's the turnaround time for translation? Do you know what percentage of patients with the portal who are non-English speakers may be requesting translation? Obviously, it's hard to know, but if you have any sense, and do you have a sense of how costly it may be?
I'm going to let Nandini answer the cost and turnaround time, but I can tell you based on what I've seen so far that I expect the number of requests to be super low. Like a lot of my patients who come into the office and speak Spanish with me in person, when they write a message to me, they write it in English. There's something about like, I don't know, it feels more official doing things in English, and so that people expect written interaction to be in English. So I don't think many people are going to request this service, but maybe I'll be wrong.
And can I circle back? I was just trying to see if I can like handily find information about the cost. I know we definitely have that information, but can we circle back to that question just in a little bit and I'll respond.
Absolutely. And I'd say as an OpenNoter, working with the team for the last 4 years, and Cait even longer, questions about note translation, we get those questions all the time. And there have been very few studies about the, how are notes translate, and the services are kind of interventions to help people get their notes translated. And if you guys figure this out, it will be huge. So.
Yeah, we don't know of any other, I haven't heard of any other organization doing what you're doing. So it'll be really, I would love to follow up with you, in 6 or 8 months and see how it's going.
Yeah, and Nandini, when you said you're going to write a white paper, I was like, oh no, this is a huge paper.
Well, we hope so. Yeah, I think I think we're all super interested and excited about providing the service for our patients. I feel like it is much needed, but we'll see, I think as Ruth said, I think it'll be interesting to see what the demand's going to be like, and to make sure that we go out there and do promote it to patients that this is available in case they do need it. So I think it's going to be twofold about just making sure that we are providing the service and then seeing what the demand's going to look like.
Very cool.
Yeah.
And Cait, if you want to talk a little bit more about what we do know about the usefulness of notes for non-English speakers, because someone else did ask, does OpenNotes advocate attempting to translate notes? And then they added on, it wouldn't be feasible when a majority of our patients don't speak English. So if you want to share what we do know.
So what we know from our research is that patients who speak a language other than English as their primary language, this also applies to people who have lower levels of formal education, that they actually are more likely to report benefits from reading their notes. And it's likely there are a few things going on. One is, I've heard someone describe they're in the visit, they're not in a concordant language visit. So the provider speaks some other language than them. They're constantly translating and back translating in their head as they're going through the visit. So that cognitive load is so high that they often don't remember much of what happened. So that's kind of one piece of it, that going back to the note is really helpful for them, because that translation process just makes it so hard to remember what was said. And the other is that we have found over the years that patients are incredibly resourceful. So they may have someone in their family who speaks English well, or they may have a cousin who's a nurse or a neighbor, or they find if they need the information, they find ways to get it from the notes.
So there were a couple questions that I'm now seeing related to the adolescent teen piece, asking, do you release records not electronically to parents of minors? So a couple just kind of clarifying, do parents still have some access, even if not through the portal?
Yeah, I mean, there are laws about that, right? Like we have to release records to parents if they request them, but you know, it doesn't happen very often. I mean, we do provide a lot of confidential care to teens. The laws in New York State protect teens' confidentiality. The laws give teens strong protection for confidentiality for reproductive and mental health and substance-related services, and we do a lot of that care for teenagers. So yeah, we have a lot of fail-safes in our system to try to protect teens' confidentiality. It means a lot of it's not really related to OpenNotes. It's more related to billing and explanation of benefits. But you know, this is an issue we deal with every day.
So the two of you probably know what this is referring to, so I will ask the question. How are you handling behavioral health provider concerns about 42 CFR Part 2? And if you don't know what that is, I can ask them to clarify.
I don't know what that is. Do you know, Nandini?
Cait might know.
I think it's related to substance use disorder. Is that correct?
All right, I will ask the person to send clarification.
This question has come up before, and unfortunately, I just can't remember off the top of my head.
I'm gonna go Google it and I'll let you guys know after another question.
Well, I could say something in general about mental health providers and OpenNotes. I mean, I know there's some organizations that didn't include behavioral health in OpenNotes, going live with OpenNotes, and we decided to do that. And what I found when I was, when we were getting ready for the rollout is that our behavioral health staff were like the best prepared. They were completely nonplussed by this. It was already totally a part of their workflow. And it's because so many of our patients are on the portal that all our mental health staff are really well versed in preparing a patient to see a mental health diagnosis on their chart. And so, they're very transparent in the way they handle those things. So it was no big deal for them.
So there were a couple of questions that I answered, but just to make sure people have the answers. One was, is translation required under the federal rule? And it is not. But we love that some organizations are going above and beyond working on that. And then in patient notes, I sent out a link in the question and answer box to our page that has a list of what is required under the federal rule, and certain types of inpatient notes are required. So you can go to that page for that. Nandini, another question related to, I know you were looking up some information in terms of the cost. Someone also asked who pays for the translation. So I don't know if you have some info to share now from what you were looking up.
Yeah, so I mean, I think I can share a little bit around the cost. So right now, at least for the initial period, we are hoping to allocate some of the translation costs towards the grant funding we received from the New York State Health Foundation. But in terms of sustainability, I think we are hoping to use this initial few months to really gauge, again, like what the demand is going to be like and what the cost is. And regardless of what happens, I mean, if we see like this is a much needed service, we are going to end up absorbing those costs just organizationally.
So you all probably have comments on this one, but do you see OpenNotes as a complement or replacement for medical recording apps currently being used by patients?
Medical recording?
So there
Yeah,
are,
there are some out there that allow that make it easy for patients to make an audio recording of what happened in the visit, or a video recording of what happened in the visit. I don't think they're extensively used at this point. I would say it would be a complement to that. If I sort of think about my own, what we know from, well, there's one project that we know of where someone is doing that, and often patients will use the app to record the visit, but then they don't often go back and listen to it. So the notes are sort of just a supplement to that.
And different states have different laws about recording visits with your doctor. Do they need to know? Do they need to know they're being recorded? Some states it doesn't. They don't need to know. And some of the apps that are coming out, there's a number of app developers doing stuff in healthcare. Some of them are trying to use AI to like take that recording and translate it and like break it down into key sections with headings automatically for patients to just make it easier to sort through the visit and different topics. But the visit note itself is a great cliff notes and summary of truly what happened and what a doctor is thinking. So it'll be interesting to see what happens as a result of this information being more visible to patients and whether or not we're going to need apps like that when we can actually read it.
So another behavioral health question note, how to chart behavioral health systems that the patient might not agree with. And I suppose this could be more broadly any notes where a patient might not agree with something you can touch on. They said, for example, delusions or poor judgment, but if you could talk about what to do when patients don't agree with something in the note or what you do.
I think the single most important thing is transparency, like, talking about what your diagnoses are, and talking about what's going to be in the note so that there are no surprises. I know what the behavioral health people do often is they pull out the DSM, whatever number it is now, and read the criteria for, say, narcissistic personality disorder. So they, go through all the criteria for that and say, does this make sense to you? Do you see why I reached this conclusion? And that seems to help a lot. So, those are examples of things that they do. Another thing we do, this doesn't exactly have to do with OpenNotes, more with problem list management, but we try to use a display diagnosis that's more friendly and less judgmental than the actual verbiage of the ICD-10 might be. So example, the obesity diagnoses, a lot of people are really offended, especially by a term like morbid obesity, whereas body mass index of 43 it's more technical, objective, and less offensive. So whenever possible, we try to substitute an inflammatory and judgmental diagnosis with something that's more patient-friendly and less judgmental.
So Cait, this is probably more for you. They are a dialysis clinic. Oh, hold on, I just lost the question. Oh, here it is. Dialysis clinic, they get electronic copies, for example, of a hospital discharge note. So they get some electronic copies of notes from inpatient stays, but they weren't generated within their facility. So the note was originated somewhere else. Do they need to share those notes through their portal?
So my understanding of this is a kind of a tricky legal question. So, and I'm not a lawyer, and so take this for what it's worth, but my understanding is that organizations do not have to share information that they receive from another facility. That requires a separate request on the part of the patient. They're only required to share they're only required to share the data that they themselves generate.
Okay, when notes are signed, some staff do not want their last name included. Is this compliant with the Cures Act?
I'm going to say yes. In the Cures Act requires that you release all of the information that you have about the patient electronically through the portal or some other electronic means. There is nothing in the rule that I know of that stipulates that the provider's first and last name has to be in there. Although I could be wrong. I mean, I haven't read that rule is it's over 1,000 pages. So it's possible that I am wrong. And Ruth, I'm wondering if you have other thoughts about that.
I think legally anyone who touches the chart has to sign
Okay.
note. So I would disagree, honestly.
Okay.
We had a drop-in clinic 2 weeks ago. Stephen Lane from Sutter Health, who's like this interoperability information blocking guru. Someone asked about there's certain clinicians, nursing staff who don't want patients to know their last name, just first name only, and we're concerned about having the name now be in the chart and it's open to patients, and concerned around like safety and other things. And essentially his response is, if they're signing in the chart and their name is in the chart, that full name will be available. And unless that organization that went through some sort of gymnastics to hide all the last names of certain types of clinicians. But I think it's one of those things that isn't spelled out in the rule specifically, but it's yes, whoever signs the note and it will be visible.
Got it. I mean, that information would be available anyway to patients if they just did a records request. So
right, exactly. If you did a written records request, you would get all of them.
Yeah,
it would be the same thing. Yeah. Oh,
so
we're
it's 5 o'clock.
Oh my gosh, 2 o'clock. Maybe we should end this thing. Unless Deb, was there a quick question or no? I should end it.
I'm going to post in the chat a link to our general webinar page, because I know there were some unanswered questions that I didn't get to on pediatric chaplains and mental health notes. One quick question, if people want to still hear the answer. And again, this might be a Cait thing. A couple of people asked about getting notes from prior to the go live date at an organization, and what is required with that.
So what is required is that you release information that you are holding in a patient's electronic health record, and that you provide it to patients in an electronic format, unless you have no ability to do that, and then you have to provide it some other way. A lot of organizations have decided to interpret that rule as, we will do OpenNotes going forward from our go live date. So if they picked April 5th, they do it going forward from April 5th, all the notes automatically go to the portal. But anything prior to that, patients can request it through our view, transmit, and download option on the portal. And the reason that organizations have done that, and it seems like that's going to be an okay way to go, is that it would be very difficult to go back through all of those notes and make sure there isn't an issue that could cause a patient harm or violate a patient's privacy. So that's the way most organizations have done it. There are some, though, that have just said, we're doing the whole thing, we're going back all the way. So that question's open to interpretation.
Thanks, Cait. Okay, so we're going to close this so you can go back to work. I want to remind everyone, next Thursday, April 22nd, we're doing office hours, all Q&A with today's presenters. They'll be returning to answer your questions. And Dr. Anshu Abhat will be with us at that time, answering a ton of questions. And she's so great, so we're excited that you'll get to meet her then. As we close, I want to say thank you to Dr. Lesnewski and to Nandini for their fantastic presentation. We learned a lot. I hope you did too. This webinar has been recorded. You'll all receive an email to the link of the recording, which will be on our YouTube page so everyone can watch it. And I just want to say, look for the link to sign up for the office hours in the chat box. And remember to check out opennotes.org for free resources and information as you're working on communicating this topic with your own patients. Thank you all for joining us.